I'm doing a series of short videos talking about thyroid dysfunction and what to do about it. And this last one is talking about ways to treat your thyroid. And I wanted to just put out there that usually your thyroid problem is not the problem. Your thyroid problem is annoying you. In fact, people are never really concerned about their thyroid problem. They're concerned that they have a headache, or they're concerned that they're tired, or they're concerned various other things. So people don't really care about their thyroid gland. They care that they feel terrible. So because you feel terrible, you go to a doctor, me or somebody else, and they say, oh, you have a thyroid problem. That's another mistake. Your thyroid is not the problem. Your thyroid is having some troubles because of some other thing. So you need to delve deeper. You need to dig, do some good detective work, and find out what's causing the thyroid problem. Your thyroid does not self-destruct for no reason. Your thyroid doesn't get slow for no reason, and your thyroid doesn't get hyper for no reason. There's some reason. You have to dig around, do a little testing, figure out what it is. When you figure out what it is, it gets better. So, starting with the causes, how to fix these problems behind the thyroid dysfunction, because those are the problems. Food allergies. If you're allergic to a food, get off that food for a couple of months, usually 3 to 6 months, depending on the severity of the food allergy. Give it a rest. Your thyroid starts to repair and get happy and function correctly again. So if you can get off the foods that are suppressing it, amazing things happen. Number 2, nutritional deficiencies. If you're low on a nutrient and you start getting that nutrient at the proper levels, start doing good. So if your thyroid's hungry for something, some trace minerals or a B vitamin or something, you get the correct amount, it starts to blossom, starts to work good again. Number 3, if there's some toxins, you just need to identify what the toxin is, what things that support the body cleaning and detoxifying itself, thyroid starts working better, if that was the problem behind it. And number 4, sometimes there's some low-grade infections, usually in the stomach, that are creating inflammation. So if you can identify what type of infection is in the stomach, try some remedies. If your medical doctor's running the test, it's going to be a prescription medicine. If your natural medicine doctor is doing something, he might recommend some herbs or something to try to strengthen your immune system, something to help your body clean out that infection. The infection goes away, inflammation levels go down, toxin levels go down, because infections produce a lot of toxins. So if you can get rid of that irritant, there goes the reason for your thyroid being grumpy. So the thorn got pulled out. So once the thorn is removed, your thyroid goes, oh, thanks, doing so much better now. I can work. I can make thyroid hormones. So remember that your headache is not the problem. The headache is a symptom of a problem. And your thyroid is the problem. No, it's not the problem. Your thyroid dysfunction is a symptom of another problem. And usually you can keep going back and you dig enough down that you find the causative factors of these problems and fix it. And your body just blossoms and heals, because that's your body's made to heal, your body's made to do well. We just need to remove the things that are suppressing the functions or lacking something that you need, that's some good stuff that you're just low on. So that's how you fix thyroid problems. Don't even work on the thyroid gland. You work on the causes of the thyroid dysfunction. Don't even work on the thyroid gland. Is milk allergy a thyroid problem? No, milk allergy is its own thing, but the milk allergy may start affecting the thyroid gland and cause some problems. So milk allergy, you need to work on that. If it's a milk allergy, it could be something else. So anyway, just want you to kind of start be thinking that it's, oh, I have a heart problem. I have a stomach problem. You have some symptoms in your stomach, but the problem is something else. So you find what that problem really is, and your stomach problem just fixes. So start to be thinking about that. We need to be better detectives and not just put a Band-Aid on our problem. We need to be detectives together, do some testing to find out what's causing the problem. Once you know what's causing the problem, you just work on the cause, and then the problem goes away. So that's kind of the detective type approach, the natural medicine type approach that I like. And if this rings a bell for you or lights up a light bulb for any of you guys, please contact me, ask me more questions. I'm here, ready to serve, ready to help and do some testing. And Just share this video if you like it, subscribe, and I'll be doing more videos. If there's something you'd like to learn about more, ask and I'll do a video series. Thanks, guys.